फेडरेशन ऑफ ऑब्स्टेट्रिक्स एंड गायनोकोलॉजी ऑफ इंडिया की प्रेसिडेंशियल कॉन्फ्रेंस पे मुझे एक लेक्चर लेने के लिए बुलाया गया एंटीऑक्सीडेंट्स पे, अ लेक्चर ऑन एंटीऑक्सीडेंट्स इन द प्रेसिडेंशियल कॉन्फ्रेंस। मेल फर्टिलिटी बहुत कॉमन चीज़ है, स्पर्म काउंट बहुत कम होता है, बहुत बार नॉर्मल स्पर्म काउंट में भी बेबी नहीं होता। इसके लिए कुछ मेडिसिन्स होती हैं जिन्हें एंटीऑक्सीडेंट बोलते हैं, जो देते हैं स्पेशली उस इनफर्टिलिटी में जिसमें स्पर्म पोल्यूशन से, खाने से, दवाइयों से या किसी भी रूप के इन्फेक्शन से ख़राब हुआ हो। और दिस इज़ नोन एज ऑक्सीडेशन। ऑक्सीडेशन को ठीक करने के लिए एंटीऑक्सीडेंट्स होते हैं, वेदर दे शुड बी गिवन और नॉट, टू whom they should be given, what is the best antioxidant, and what is the dose. All these things I have discussed in this conference. I would like you to see this whole lecture so that you may understand antioxidant therapy in male infertility.
I'd like to talk about antioxidants because primarily antioxidants have changed the way male fertility is looked at. And it has changed in the last decade, the way we would look at antioxidants. So I'm going to divide my 15 minutes into 5 parts of 3 minutes. First is, what does ROS do? Why is it needed? And what is the side effect of having ROS? The second I'm going to talk to you about is MOSI, male oxidative stress infertility. Third, I'm going to touch upon sperm DNA fragmentation. Fourth, I'm going to touch upon what are the myths and what does literature say. And fourth, I'm going to tell you about a few antioxidants and what do they do. So the first important thing is we all know 1 out of 7 couples do not have children, which amounts to about 15%, which amounts to about 10 crore people in this beautiful country of ours. And male infertility is highest in Africa, Eastern Europe, and the Middle East. And male contributes about 50%. Now, this is a very interesting slide because it gives us two basic things, that about 50 million men across the world have known or unexplained reasons for male infertility. And about 50% of them, which is equivalent to about 50 million men, have idiopathic. And in this idiopathic, about 80% is because of oxidative stress. The interesting thing is that this poor sperm who's made in the testes, there is spermatogenesis, spermiation, epididymal maturation. This sperm is finally ejaculated. If the sperm has a forward motility, there is capacitation, hyperactivation, chemotaxis, fertilization, and acrosome reaction. All these things need reactive oxygen species. So the importance of ROS in sperm function is very simple. Capacitation is needed. ROS is needed for the acrosomal reaction at the time of before fusion, and the egg penetration is done by the help of reactive oxygen species. पर अगर रक्षक भक्षक बन जाए, तो what happens in that? And what happens over there is that the sperm is extremely vulnerable to ROS, especially the membrane. The membrane of the sperm has unsaturated fats. And the moment it gets these ROS for saturation, it leads to the destruction of the membrane. There is very little antioxidant in a sperm because the sperm is packed with DNA with very little cytoplasm. And because of the little cytoplasm, the scavenging activity of antioxidant enzymes is not there. And oxidative stress directly leads to DNA damage. Now, I've told you the 3 places where it acts: on the sperm DNA, on the sperm mitochondria, on the sperm membrane. Now, this is a beautiful paper, which is one of the most read and cited paper, of which I was also a part of this massive paper, which is male oxidative stress infertility. So if you look at the infertility causation in idiopathic, where 80% is caused by male oxidative stress, and if you look at this small diagram, you'll realize that there are endogenous reasons, lifestyle factors, environmental pollution, and health conditions. So the endogenous causes in the semen itself could be something like immature sperms, leukocytes, infection, and varicocele. Lifestyle is beautiful nowadays. McDonald's, buns, burgers, fatty diet, smoking, drug addiction, alcohol, and of course, stress. All these things together lead to DNA fragmentation and oxidative stress, health conditions as urinary infections, and of course, environmental pollution, which is there everywhere. Now, this is the other paper, which is a review article, the largest review article on sperm DNA fragmentation. I was lucky enough to be a part of this. And just to understand shortly, a normal sperm chromatin is needed for genetic transmission. In case there is DNA fragmentation, it leads to unexplained infertility, recurrent pregnancy loss, poor outcomes in IVF and IUI. And the principles are simple. You've got to quantify the DNA leakages, breakages, single or double strand. There are a lot of assays which are available, but I'll just give you one small thing over here. You do a DNA fragmentation testing on a fresh semen or a frozen. By frozen, I mean a liquid nitrogen frozen semen sample which has been thawed. So when you think you're going to send a sample to a laboratory which is taking your semen sample for a DNA fragmentation, you just ask them, how are you going to transport it? Because they're going to tell you liquid carbon dioxide, which is not the transport mechanism for a sample of DNA fragmentation. Now, the question is, what is the indication of giving antioxidants? Repeated IUI or IVF failures, varicocele, advanced male age, history of genital tract infections, smoking and other lifestyle risk factors, idiopathic or unexplained infertility, and recurrent spontaneous abortions. Now, lots of controversies. I was just looking at the time actually. Lots of controversies, dosage, when should we decide to change the antioxidant, lack of randomized placebo-controlled trial studies, duration of treatment, single or multiple components, cost, what type of antioxidant to use, what is the best marker for evaluation of OS, and is it effective at all for all idiopathic infertility? Well, first myth is few trials are published. So I'm going to tell you about literature, 33 blinded RCTs, 12 unblinded RCTs, 52 uncontrolled studies are published. Second is multi-center studies are needed with larger samples. Cost of multicentric studies in this probably is unaffordable by most investigators. Placebo-controlled studies should be performed. Denying treatment to patients in the name of placebo probably also would be unethical. Length of AOX treatment is usually insufficient. It needs to be taken for more than 3 months. More rigorous patient selection is needed. Many studies published in AOX treatment in patients with varicocele, abnormal semen quality, urogenital infections have been there and can be visited. Need more studies investigating combinations. Most of the studies are based on combinations, and I will also mention more than 25 studies are those of combinations. Registered antioxidants, 24 studies, and individual antioxidants, 45 studies. Pregnancy and LBR outcomes need to be evaluated. They have been, and there are very several studies about it, and molecular basis is not known. It is very well known, which I'm going to talk to you about after this. So I'm just mentioning over here about the Cochrane review that preliminary evidence of 3 small randomized controlled trials suggests that antioxidant supplementation in subfertile males may improve live birth rates for subfertile couples undergoing ART cycles. Now, what's the molecular basis of antioxidant treatment? Number one, they act as ROS scavengers by neutralizing harmful ROS. They are DNA protectors, and they keep and maintain the membrane integrity. Now, the next question is, what all are the, I would say, antioxidants available? So the most commonly used antioxidant all over the world and even in our country is coenzyme Q10. Now, it's known as ubiquinone because it's available in every cell. How many of you remember the Krebs cycle? Remember the Krebs cycle? When you remember the Krebs cycle, you realize that one of the main powers, energy givers in over there has been coenzyme Q. So it's available in every cell. It's a fat-soluble compound when you take it orally, in high concentrations in all energy-demanding cells, and one cell which needs the maximum energy in the human body is the sperm. Now, the role of energy production is vital, and coenzyme Q plays a role in it. And more importantly, it supports the sperm count as well as the sperm motility. Now, coenzyme Q, one person always asks, what is the concentration in which you should take it? Does it get concentrated in the seminal plasma? So I'll just come to it, the concentration which you need and how much do you need to take coenzyme Q. Now, what happens when you have oxidative stress and the place of coenzyme Q? See, reduced coenzyme Q has been seen in hypogonadism, age-related decline in fertility, increased rate of embryo aneuploidy and ovarian aging, and high sperm DNA fragmentation. Now, this is a study which has come up, and it shows one thing clearly, that coenzyme Q therapy given over 3 months can give an increase in the sperm count. Coenzyme Q study can improve motility, and coenzyme Q study, the beauty about this study was, when I read it, was that it leads to an increase in the overall pregnancy rate, especially in those people who have had unexplained infertility. Now, what dose of coenzyme Q is optimal? So what you actually need is 2.5 microgram per ml, which comes to about 200 to 600 milligrams of coenzyme Q in a single or two divided doses. The second thing I'm going to talk to you about is L-carnitine. L-carnitine, why? Because it's a nutrient synthesized in the body from amino acids, and though it's commonly found in meat and dairy, it is also present in nuts. L-carnitine helps in transporting fatty acids to the mitochondria, where they're broken down and used for energy, and it supports sperm function. Next, of course, lycopene. Lycopene, we all know you get it in anything which is red. I always tell my patients, to eat, you need to take anything which is red and yellow, and your vegetables should be green. Your food should be whole. Without, I always tell them that in your food, remember the fiber should be there. Now, the overview of lycopene is that lycopene is a powerful antioxidant, and its role is to help the patient's cell from free radical damage. You know, just understand, I'm not talking about the sperm. I'm talking about aging. I've read a lot about aging because I was wanting to make a series for the YouTube on aging. So when I was seeing all these papers, I realized that whatever is given there for the sperm is actually what is given there for aging. The only thing is that the sperm gets affected the most because it's the only fast dividing cell of the body, made in millions every day, with only DNA in the head and no protective cytoplasm. Now, it protects the sperm, which is lycopene. Now comes the role of zinc. You can see these beautiful oysters. They look like jewelry. But the fact remains that whether it's meat, shellfish, oysters, seeds, or nuts, the zinc is an ingredient of all this food. It has a fantastic role in testosterone production, especially from the enzymatic processes, and it supports sperm development. Astaxanthin for male reproductive health. Most commonly found in seafood, salmon, trout, and shrimp. It's a very powerful antioxidant capable of neutralizing most of the free radicals and supports male fertility. Now, the question is, what combination to make? Now, there are three things to get into your mind. Number one, any antioxidant given for less than 3 months, you might as well not give. A single sperm would take about 74 days to get made from the very beginning. So you might as well give the patients antioxidants. Number two, if they have any lifestyle problems, they need to be corrected. Number three, if there is seminal infection, it needs to be treated. If the patient has grade 3, grade 4 varicocele with a semen analysis report which is not commensurate with normal, please operate microsurgically. So L-carnitine, lycopene and astaxanthin, zinc. Now, more importantly, patients need nutritional support for a long time. Both the husband and the wife, if they take the kind of food which is going to give antioxidants, the egg as well as the sperm would be better. I just have 29 seconds. Now, the future of male fertility is going to be very precise, tailored treatment in the future of antioxidants. I'm talking of antioxidants at the moment. More accurate diagnostic tests apart from the ROS measuring tests which we have at the moment will be available, and combination therapies would be available for different areas and different problems of sperm. Probably for motility it's going to be different, for sperm DNA damage is going to be different. That's the way probably these therapies are going to come up in the future. And of course, in the end, idiopathic male infertility is a broad diagnosis. Diagnosis of a large number of patients are incorrectly diagnosed at the moment. The cause needs to be diagnosed if possible. MOSI is very easy to diagnose and has a broad area worldwide. About 80% of idiopathic patients have male oxidative stress. Doctors and patients must understand the concept very deeply. And this is something which can be practiced in every person's clinic. More importantly, antioxidants can be an effective tool to improve female fertility as well, where oxidative stress is there, especially in aging and PCOD. However, it's important to take into the account of individual conditions, what the patient has, how to give them antioxidants, alone or in combination, the duration. Now, there are two things which are most important. Number one, I'm just finishing off. Number one, the duration. Please do not give any antioxidant for less than 3 months. And number two, the dosage. If you give them in a low dose, it is as good as not giving them. And if you give them in a higher dose, you know what happens? It can cause reductive stress, which can lead to other pathological conditions. So it's important to give them in the correct dose for the correct time. Very simple to give, available off the counter. Well, even if you cannot investigate and you find all the causative agents, you can give them. And I think these simple things are beautiful. But please, one small thing before I end. Get them into a better nutrition and lifestyle. Lifestyle and nutrition is normally ignored. And I think that becomes very important for all of us to have anti-aging therapy, and especially for the sperm at this moment. Thank you very much.
If you are here till now, then let me tell you one small thing. I would like to give you a free gift, and the free gift is in the link below. It is a few papers which you could use for antioxidants and read them through. These are the most cited papers. ये सारी पब्लिकेशन वो हैं जो आपको ये बताएंगी कि आपको यूज़ कैसे करना है, कब करना है, और स्पर्म डीएनए फ्रेगमेंटेशन के बारे में जो मोस्ट रिसर्च्ड पेपर्स हैं वो मैंने इसमें दिए हुए हैं. लिंक पे जाके आप ले सकते हैं, क्योंकि सबसे ज़्यादा आनंद हमें एक ही चीज़ में मिलता है, पेशेंट्स को बेबी देने में और ये नॉलेज फैलाने में, जिससे लोग अल्टीमेटली एट द एंड ऑफ द डे मेल्स का अच्छा ट्रीटमेंट कर सकें.